We are gonna start.
Okay.
So I sent you yesterday. I hope you had a time to see it. Just a very brief agenda for today. So the
Mhm.
idea will be to update you in some developments that have been going on since the meeting in Brussels when we had the last board meeting. So basically, I wanted to update you on the initiatives and developments that the Pan-ERN research working group is just accomplishing, and basically the results of a meeting that took place the 24th of January in Brussels. So
Mhm.
basically, as you know, apart from the efforts that each ERN is doing in terms of research and any other areas, um, there was an idea of the 24 coordinating centers that meet regularly every 3 months in Brussels, usually, to create working groups in order to, as a whole group, the 24 ERNs all together, just tackle different needs and different areas that were important for the good development of all the ERNs, thinking also that all together we could have more strength in order to get a better implementation in the whole European scenario in terms of the different activities related with ERNs. So you know that there are several working groups that have been created. One of them is research, and then the idea is this research working group is quite large in terms of the number of participants. All ERNs or most ERNs are participating in this working group, so it's the biggest one in comparison with other working groups. And then because there are several activities and several tasks, instead of having one coordinator, there are four coordinators that will rotate periodically in sharing the activities of coordination of the group, of acting as an expert person. And also there is some help as other groups from the DigiSante, so the person of contact that helps with the activities of the groups in relation with research is Helen Leborn. So this group meets, um, or we have opportunity for discussion during the meetings of the whole year ends that usually, as I said, these meetings take place every 3 months. But the last 24th of January, there was a first workshop of this year-end working group. And then the idea is that we are working in how to connect or to be involved with all the pan-European initiatives that are related with rare diseases. So we have been discussing this in other research meetings in the previous board, and what we are trying to do today is just to give you an update or what things or what's going on in this working group. So basically, as I told you, the idea is that, well, in this workshop, we had it was like the first time in which independently the working group was meeting, on the contrary to other groups that really have very immediate needs when the ERNs started, because, for instance, the one of IT development immediately had to work on the development of the CPMS, or quality needed to immediately start working on the definition of outcomes and ways to measure the activity of the ERNs. The activity of the research working group is just probably just more difficult to start, because we needed first to agree on what we understood that research just coming from ERNs, what will be the ways to all work all together, and how to align the initiatives that all ERNs may be having independently in a common strategy or in a common way of pursuing the objectives. So for this, we had the help of a contractor that the European Union hired for some months. I mentioned this to you in the last board meeting. So there is already a very preliminary draft of what this group, that is a company that is just called Jonathan Olson Consulting. So these are people that are experts in this kind of studies and analysis. So basically, they are just analyzing the documentation and the information about, of all the ERNs, and trying to see what would be the areas, or what would be the best way to take advantage of the potential and the capabilities of ERNs in terms of research, in order to somehow promote a common research strategy for all the ERNs. So, so far, what we have is just a very preliminary draft that will be just polished in the next weeks, and that I will make you available, because it's still not fully available to all the participants of the ERNs. And basically, the idea is to see how different ERNs could collaborate together, how we could do advocacy about the importance of the ERNs in the whole European scenario in terms of research and in terms of rare diseases. So basically, if you remember, we circulated a survey in our ERN in transplant child, trying to identify all the projects that were ongoing, all the researchers that were participating in different activities. So, well, thanks to all this information, they are preparing this document that will just lead to the definition of a common strategy, and then also to identify priorities and see how the fact that we could go together instead of working independently, each ERN, will probably increase our capabilities. So this is because you remember that although the ERNs are not research consortia, they are really requested, and among the different requirements that ERNs have in terms of when they were approved, we need to pay attention to research. We have to make contributions to research. So the idea is that we have to identify the research gaps in our different areas of interest, to promote collaborative research within the network, and also to reinforce research and epidemiological surveillance through the setting up of shared registries. And that's why another point of the meeting today will be to tell you about the possible new opportunities to create a registry for pediatric transplantation. So let's basically, I don't want to go into give you too many details because it may not be easy to follow just in a presentation, but hopefully in the next board meeting, in a face-to-face meeting, we will have more advanced all these activities, and we could discuss more easily all these points. But basically, obviously, the research working group from all ERNs need to interact with other working groups. And for instance, in the working group of monitoring that is defining indicators of activity for each ERN, there are some indicators that are related with research. So the idea is that we have to give information about how many research initiatives in terms of clinical trials or studies are going on in the different ERNs, and the fact that this, in order to be considered activities of the ERN, need to involve at least 2 different members of the network, 2 different healthcare providers of the network. And then there are other indicators of the activity in terms of research of the work of the ERNs, as for instance the number of publications in different scientific journals, or as readout of the activity of the network. So this is only to remind you that as a network, we need to provide this kind of we have to fulfill indicators. So you know that we are just aiming to start publishing all together different initiatives, and we discussed this in the previous meeting. So you probably will see the first paper that we try to publish all together, although it's not directly from research, but it will be the first paper, the position paper, that will be the first publication that as a network we will produce. And there is this idea of completing projects like the AB0 incompatible project in order to start creating and building up this capacity. And obviously there is an important need for the research working group, and this is being discussed in the legal and ethical working group, and is the relation with other stakeholders. We all understand that at some point ERNs need to interact, for instance, with industry in order to be really able to promote research initiatives, clinical research, and because the funding for the research initiatives is still scarce, and that's the European Union is trying to increase the awareness of ERN in the different policymakers and the different departments that define what will be the topics for the next calls, for instance, the last calls of the Horizon 2020 and the forthcoming calls. But still, even with that, even if we have somehow access more easily to public funding through the European Union, still to fulfill maybe many of the objectives of the networks, at some point in the future, interaction with industry is going to be needed. So far this is still not solved, so it's not easy for ERNs to see or to initiate any activity in that sense until there is not an official position from the Board of Member States and the European Union, and this is something that is being addressed in this other working group, the ethical and legal issues and relation with the stakeholders, because probably they will publish a policy in terms of conflict of interest, and all the interactions with industry will be well defined for all the ERNs. So basically, well, there are some things that needed to be agreed in this meeting in the 24th of January. So, for instance, how we define ERN research, the research working group, how understands that any research activity could be associated or could be named as research coming from the European Reference Network. And then in order to define what will be a research activity, as I said before, this should involve at least 2 different ERN members of 2 different member states in order to any activity to be accompanied or to be supported by the statement, for instance, on behalf of whatever ERN, or as to be considered as activity from the research, from the ERN in terms of research. And basically, this is the summary of the network that took place, the meeting that took place the 24th, and then the major agreement that we reached there is that the objectives of the research working group, as you see here, will be to promote advocacy, coordination, facilitation, and to have some added value for European research through multidisciplinarity. And the next steps or the next tasks that the ERN working group in research has established would be first, as a consequence of this activity of analyzing the research capabilities of the network, there is a conceptual document being prepared of how all ERN can just address research in the European scenario. There will be some information directly related with research for the 24 ERNs as a whole. So the research working group will have some information portal, and this is still in construction. We don't know exactly what will be the first or what will be the final appearance of this portal. It probably will be a website, and then. Because in Europe there are many initiatives that are going on now, and there are many infrastructures and research consortia that are just doing many activities around the rare diseases. There is an idea of organizing a meeting between ERN representatives for the 24 ERNs and these infrastructures in Europe, just to see how they can profit from each other. So how ERNs are well aware of all the infrastructures that are available in Europe, and how these infrastructures that may have been developed before the ERNs were born could really realize how interesting or how important may be to interact with ERN. And then ERNs are also having some contacts periodically with the European Medicines Agency. There was a workshop in May last year in which representatives, it was a workshop promoted by RD Action, in which the ERNs met with people from EMA and from other stakeholders and initiatives in Europe, and this is going to be kept active. So the idea is to promote another meeting with EMA probably in 2020, because this year they are very busy with the change of location, but it's something that is in the scope. And then finally, another task will be to be able to provide new possibilities for the ERNs that were not able to get funded for the creation of registries. In the call, if you remember, we applied to a call that just was published 2 years ago, and we were not funded, and though we were the first ERN that got in the ranking of the evaluation of the proposal, the fifth one or the sixth one to be ranked, but only the fifth registries of five ERNs got funded. So there are several that are not still funded in order to trying to create registries in their areas of interest. And as we will tell you later, there is another, there may be some possibilities in this coming year in order to get another call in which ERNs not competitively could apply just to get funded for the creation of research registries. Can you hear us?
Yes, perfectly.
Okay, sorry. So this was in terms of the first point of the agenda. I don't know if you have any comment, or if you, maybe it's too much information, but I wanted to let you know about all the initiatives that are ongoing in the whole ERN scenario. So I don't know if you have any question or any comment.
Actually, no. As far as I understood, a part of this ERN-specific research, there is an intention to create this pan-ERN research activities. Is it so?
Yeah. So at least to have a common strategy to try to merge in some initiatives and try to see that the idea will be that each ERN could promote obviously research independently, but also that maybe collaboration with other ERNs could be enhanced or could be promoted, and maybe even that different ERNs could collaborate together to apply together to different funding opportunities. So the idea is trying to promote as much collaboration as possible among ERNs in terms of research. And in any, so I think that basically the scenario and the basement is being created just to promote this.
But the funding that is offered by the European Union is mostly dedicated, let's say, for exchange, for mobility, and things like that, not for research activities itself.
Yes, exactly. That's yet the main problem, and that the ERNs do not receive directly money for research or for research activities. So far, what European Union is trying to do, or what the DG Sante is trying to promote, is that for instance, DG Research in the future calls could contemplate the potential and the capabilities of ERNs, and could somehow promote the launch of calls that somehow could be maybe not completely directed to ERNs, but at least that could favor that ERNs could apply for this type of calls. So the idea is to work together just to see in the future the money for research could come from parallel sources, but not directly from the sources that just so far sustain the ERNs. So that's why there is still obviously some delay between the initiation of the activities of the ERNs, and now is when we are thinking how to promote in the future new opportunities for research. So the first one, if we want us to continue, and this is just because you probably heard about this, before the ERNs were created, there was already an initiative in Europe that was the launch of an European Joint Program on Rare Diseases, and that's how I bring you this slide very briefly from Daria Juglowska, which is the coordinator of this program, the European Joint Program on Rare Diseases. We were telling you the last year that most ERNs are participating in this initiative. We are participating in different activities that I will just outline you briefly in a moment. And this is the first example of how a parallel initiative that was already ongoing before the ERNs were born has just somehow host many of the ERNs and many of the people participating in the ERNs. And this is just a way in which partially, because unfortunately the money allocated for ERNs is not very big, but at least how this idea of ERNs being now considered or being in the whole in the whole rare diseases scenario, how different initiatives like the EGP and the ERNs are trying to somehow merge and potentiate mutually. So this is just to remind you that there are many initiatives going on in Europe in relation with with rare diseases, mostly to fulfill the needs or the requirements of the International Research Initiative on Rare Disease Research, the IRDIC. And then there are many infrastructures already in place in Europe. These are the ones that I told you before that maybe we are trying to promote a meeting with representatives of all these infrastructures and ERNs probably in April this year. And then obviously there are patients associations, there are initiatives in clinical research, IATRIS, and initiative for research in children as Connect for Children. And then there is this opportunity of funding from the European Union, which are the eRare initiatives. So the ERNs, the European Joint Program on Rare Diseases was officially started in January this year, so just started, and the ERNs are participating in different activities of the European Joint Program. So you can have the information about they have already a website in which you can see exactly the definition, the structure of the EGP. This is a very complicated, I must say, initiative because it involves many partners, many different countries, many different infrastructures from hospitals to universities to academy from different countries. So it's a quite big initiative. So basically, and this is just an example, how we promote our participation in the European Joint Program on Rare Diseases, being a reference network that is focused on a procedure rather than the diagnosis of the primary disease, is by the fact that many rare diseases still or need transplantation as the curative procedure. You know that this is one of our leitmotifs and one of our points or arguments of one of the reasons of why we think that improving transplantation will improve the care of many rare diseases in Europe. And this is a way in which we think we need to be present in any initiative in terms of research, clinical research, basic research that is in relation with rare diseases. So in order to have strong arguments for this, you know that we have made an effort in the last year, and for this Juan Torres has been working very hardly with the healthcare working group of the network in order to identify, for instance, in the Orphanet classification, in the different diseases that are collected in Orphanet, those diseases, rare diseases that have transplantation, either solid organ transplantation or bone marrow transplantation, as a major or the only curative procedure. So this is already been, it has been revised. There are hundreds of different rare diseases that require transplantation for treatment. And then this is going to be included now as a different ORFA code, ORFA coding in Orphanet. So Orphanet is very happy to define or to specify in their websites all the rare diseases that need transplantation in order to have a strong let's say, argument or a strong reasoning in order to justify how transplantation is really important for rare diseases. So this is something that will be available for everybody. It's not very big here, but you will see that all the rare diseases that, for instance, require hematopoietic stem cell transplantation or liver transplantation, kidney transplantation, are going to be perfectly identified in Orphanet. So basically, the EGP is very complicated, and as I told you before, there are 4 different pillars with different activities. So mainly we are involved in pillar, or the pillar 1 is only to promote transnational calls, as ERANET used to do before. And then basically there are 3 pillars in which we participate, mostly in pillar 3, in which ERNs will have activities in education in the different areas of interest. One will be to identify there are different work packets. Working packet 16 will be in charge of identifying all the training opportunities that are already in place in Europe in the different areas that are covered by ERNs. And then working packet 17, in which most ERNs also participate, will be in charge of developing new training and support programs for training of researchers and trainings of people involved in research activities in the ERNs and other, obviously, in other initiatives across Europe. And the idea of this will be to, if it's needed, because it's not already satisfied in different courses in Europe, will be to create new training materials. And then there is another working part, another pillar, that is pillar 4, that is going to promote innovative methodologies for clinical studies in order to look for new ways to accelerate research in rare diseases, clinical research in rare diseases, and then ERNs will be participating in this. And pillar 2 is more complicated, because pillar 2 is a lot of infrastructures and initiatives in terms of the use of omic technologies, integration of data, integration of different capabilities across Europe in order to promote research in rare diseases, mostly devote to the definition of the genetic cause and the natural history of different diseases, but already they consider the possibility of applying these kind of strategies or these kind of capabilities to different scenarios, as for instance could be the follow-up of the transplanted child and all the complications and the rare diseases that may appear as a secondary as a consequence of a transplantation.